The Medical Educationists Association Uganda has held its annual General Assembly for health tutors and clinical instructors with a renewed call to improve the quality of training across the country's health education sector. This meeting, held at Mulago National Referral Hospital, featured the election of new leadership and a strong emphasis on enhancing practical skills among trainees. We have more in this story.
Health tutors and clinical instructors under the Medical Educationists Association Uganda have elected Godfrey Sechizivu Kafero as their new president, with a commitment to strengthening the training of health professionals nationwide. Kafero takes office at a critical time as stakeholders note that current training is not sufficiently aligned with real-world healthcare needs.
As an association, we are going to target tutors' welfare and ensuring that all training schools have qualified tutors who are supposed to give the training, and so that we can monitor the skills, whether all institutions have qualified tutors who are skilled to teach, and from that we expect that after having good tutors, also the health care of the country has to improve.
The chief guest, Dr. Safina Kisu Musene, Commissioner for Health Education and Training at the Ministry of Education and Sports, urged tutors to familiarize themselves with the TVET Act, describing it as a game changer. She emphasized the importance of hands-on learning in producing competent health workers capable of meeting Uganda's healthcare demands.
Our learners are very innocent that sometimes they don't know even what is going on. So we need to create learner support systems that can help them to survive. Medical training, as a professional training, it is a training that is a bit risky, and therefore we need to protect our learners.
The outgoing president of MEA Uganda, Aaron Namasa, pointed to persistent staffing gaps, warning that shortages continue to affect service delivery in health facilities.
Many of these training institutions currently do not have the governing councils yet established. We only ask that this be expedited so that we can have more health tutors recruited, because the workload is still much and yet tutors are outside there waiting to be appointed.
He, however, expressed optimism that implementation of the TVET Act will help streamline the role and operations of health tutors.
It is trying to coordinate these arms that have previously operated in a fragmented way. So it is bringing in coordination. It is not bringing in any new skill.
A pedagogy expert with Annabelle Palmogala highlighted a growing disconnect between trainers and trainees, which she says is impacting the quality of health services.
The students are not getting the right attitudes, the right ethics, and also they are not getting all the skills that they could get. Not only because they are not interested or the tutors are not interested, the tutors are few, the students are very many. The equipment is little and the students are very many. So many gaps.
Stakeholders are now hopeful that a renewed focus on practical training alongside policy reforms will help bridge the gap and improve outcomes in Uganda's health sector. Sandra Kahunde, Robert Whiter, UBC News Tonight.